Welcome to today's video, where we'll be diving deep into a fascinating and sometimes challenging condition called nephrocalcinosis. Nephrocalcinosis, in simple terms, is a condition where calcium deposits build up within the kidneys. This can impact kidney function and lead to a variety of health problems. We'll explore what causes it, how it affects your body, how it's diagnosed, and what can be done to manage and potentially prevent it. So, what causes nephrocalcinosis? The causes are varied and often complex. One of the most common culprits is hypercalcemia, which is simply having too much calcium in your blood. This can be due to several things, including hyperparathyroidism, a condition where the parathyroid glands produce too much parathyroid hormone, leading to excessive calcium release from bones. Certain genetic disorders like distal renal tubular acidosis can also disrupt the delicate balance of calcium and acid in the body, predisposing individuals to calcium deposits in the kidneys. Medications such as certain diuretics and high doses of vitamin D supplements can also contribute. Furthermore, rare metabolic disorders like primary hyperoxaluria, which leads to excessive oxalate production, can indirectly contribute to the formation of calcium oxalate crystals in the kidneys. In children, prematurity and the use of certain medications can increase the risk. Now, let's understand the pathophysiology behind nephrocalcinosis. Essentially, it's a story of calcium exceeding the kidney's ability to handle it. When there's an excess of calcium, or when other factors, like oxalate or phosphate levels, are imbalanced, calcium salts begin to precipitate out of the urine and deposit within the kidney tissue. These deposits primarily accumulate in the renal tubules and the renal interstitium, the spaces between the tubules. Over time, these deposits can trigger inflammation and damage to the kidney cells. This inflammation can lead to scarring, known as fibrosis, and can eventually impair the kidney's ability to filter waste and regulate fluid balance. If left untreated, the progressive damage can lead to chronic kidney disease. In terms of epidemiology, the prevalence of nephrocalcinosis varies depending on the population studied and the underlying cause. It is more common in individuals with predisposing conditions like hyperparathyroidism or certain genetic disorders. In premature infants, the incidence can be higher, particularly those who require certain medications or nutritional support. While it can affect people of all ages and ethnicities, understanding the risk factor associated with specific populations is crucial for early detection and intervention. What are the signs and symptoms of nephrocalcinosis? Unfortunately, in its early stages, nephrocalcinosis often presents with no noticeable symptoms. This is why it is often discovered incidentally during imaging tests performed for other reasons. As the condition progresses and kidney function becomes impaired, symptoms may start to appear. These can include frequent urination, especially at night, increased thirst, blood in the urine, flank pain, and in severe cases, symptoms of kidney failure such as fatigue, swelling, and loss of appetite. In children, failure to thrive or developmental delays can be indicators. Diagnosing nephrocalcinosis typically involves a combination of imaging studies and laboratory tests. The primary imaging modality is often a kidney ultrasound, which can detect the presence of calcium deposits within the kidneys. A CT scan is more sensitive and can provide a more detailed view of the deposits. Abdominal X-rays can also sometimes detect calcium deposits. Laboratory tests including blood and urine analysis are crucial for identifying the underlying cause. Blood tests can measure calcium, parathyroid hormone, creatinine, and electrolyte levels. Urine tests can assess calcium excretion, pH, and the presence of other substances like oxalate or citrate that may contribute to the condition. In some cases, a kidney biopsy may be necessary to confirm the diagnosis and assess the extent of kidney damage. While nephrocalcinosis isn't strictly classified into distinct types, it's helpful to consider its causes in order to categorize it. We can think of it as being related to hypercalcemia, caused by conditions like hyperparathyroidism or vitamin D toxicity, hyperoxaluria, due to genetic disorders or dietary factors, renal tubular acidosis, which disrupts the acid-base balance in the kidneys, or idiopathic causes, where the specific reason for calcium deposits remains unknown. The treatment and management of nephrocalcinosis focus primarily on addressing the underlying cause and preventing further kidney damage. If hypercalcemia is the culprit, treatment might involve surgery to remove a parathyroid tumor or medications to lower calcium levels. For hyperoxaluria, dietary modifications and medications to reduce oxalate production may be necessary. Managing renal tubular acidosis involves correcting the acid-base imbalance with alkali therapy. In all cases, maintaining adequate hydration is crucial to help flush out excess minerals. Medications such as thiazide diuretics may sometimes be used to reduce calcium excretion in the urine, but they must be used with caution. Regular monitoring of kidney function is essential to detect and manage any complications, such as chronic kidney disease. Dialysis or kidney transplantation may be necessary in severe cases where kidney function is severely compromised. Prevention is key, particularly for individuals at risk. This includes maintaining a healthy diet with appropriate calcium and oxalate intake. Drinking plenty of fluids helps to keep the urine diluted. Regularly monitoring calcium and kidney function, especially if you have a family history of kidney stones or conditions that affect calcium levels, is also crucial. If you are taking medications or supplements that can increase calcium levels, discuss the risks and benefits with your doctor. For premature infants, careful monitoring of calcium levels and appropriate nutritional management can help reduce the risk. The prognosis for nephrocalcinosis varies greatly depending on the underlying cause, the severity of kidney damage, and how well the condition is managed. Early diagnosis and treatment of the underlying cause can often prevent further progression and preserve kidney function. However, if left untreated, nephrocalcinosis can lead to chronic kidney disease and eventually kidney failure. Recent research is focused on identifying new genetic markers that predispose individuals to nephrocalcinosis, as well as developing more targeted therapies to prevent calcium deposition in the kidneys. Studies are also exploring the potential role of nanotechnology in delivering drugs directly to the affected areas of the kidneys. These advancements offer hope for improved outcomes and a better quality of life for those affected by this condition. Thank you for joining us on this exploration of nephrocalcinosis. We hope this information has been helpful and informative.